Okay, we are going to talk today about something that has been on my mind recently for obvious reasons, and I've never lectured on before, so I'm kind of excited about it. Plagues. And we're going to start off by listing some examples of them and how they affect different populations in different ways. Then we're going to talk about bacteria and antibiotic resistance. We're also going to talk about the 1918 influenza and how people's actions at various points affected it. And finally, we're going to wrap up with the HIV crisis. So lots of different plagues of various sorts, and that will lead us to finally discussing coronavirus in the next lecture after this. There's a bunch of examples of some historical plagues that have killed millions. So many of these are bacteria or viruses. In fact, all of the big ones are bacteria or viruses. They tend to have vectors of various sorts. A vector is how the disease promotes itself. Fomites are things that you leave around and stuff that you touch, right? So just touching things, for example, infected blankets might lead to smallpox infection that killed enough people to allow entire societies to be overrun by vegetation in the New World, so much so that it created a miniature ice age in the late 1700s, which is one of those interesting details that I can get into, showing just how the world is so connected, that there was a dip in the late 1700s that caused crops to fail, which led to the French Revolution being exacerbated, which led to things like the metric system and Napoleon Bonaparte. And that might have been due to the New World smallpox. Similarly, the Black Death completely changed the structure of European society, as there were more people to there were fewer people to feed and more food available. Even the Spanish flu, which killed about 50 million people around the world, which we'll talk about, completely changed the world. It killed more people than either of the world wars. There's a couple of factors that matter in various plagues and pandemics. One is something that you may have heard about called the R naught factor. Basically, how many people an infected person infects. So with the Middle East respiratory syndrome, each person on average infected less than one other person, right? So most people didn't infect anybody. Some people infected multiple people. The high end, there's diseases like measles that if one person is sick, 12 to 18 other people can get sick because of them. That means that in order to curtail measles, you essentially need to have about 95% of the population be immune to it via either having had it before or a vaccine. Whereas diseases that have lower R naught values, that is infectivity, you need a lower in order to develop herd immunity. There's extremely deadly diseases like Ebola, which thankfully is that deadly. If it were less deadly, maybe it would spread more. Common cold spreads a lot and thankfully isn't that deadly because it does spread quite a bit. Some diseases go away within a day, others last an entire lifetime, which can be brutally ironic if the disease happens to be terminal the way some HIV is. There's diseases that do not spread if you don't know that you have them, and then there's diseases that do. There's diseases that take a very short while to develop into the full disease, and then there's diseases that take many, many, many years. Right, so there's this big range, and you can map out various aspects of these. into, quote, disease spaces, right? And you can see how there might be some diseases that are very deadly that you want immediate vaccination as soon as possible, right? Mumps, whooping cough, malaria. It's killed hundreds of thousands of people every year and kills. Tuberculosis has been bad, polio has been bad, smallpox, right? Like very, very deadly, very contagious diseases. People, depending on the disease, have been affected quite differently, right? So some diseases have affected really young people. Other diseases affect really old people. It seems that with some of the more common diseases, if you're very young or very old, it tends to be more likely to affect you. And then there are particular diseases that are particularly deadly, depending on the year or the time, the patient, whatnot. So diseases differ. It should probably not be that controversial. Okay, let's move on to the next section and talk about bacteria. We discovered the very first real antimicrobial in 1928, penicillin, right? You've heard of penicillin. Within about 12 years, we discovered creatures that were immune to it, that had resistance to it. And while there's lots of different antibiotics, they tend to be broken down into very few classes of antibiotics, that is, the ones that are active in particular ways. So one thing that's particularly troubling is if you look at the top, discovering antibiotics, and then how quickly after we discover some of these, we discover resistance to them out in nature. There is a 30-year gap between the one discovery in the late 80s and a more recent discovery that still hasn't made its way through testing of different antibiotics. There's just not a lot of money into it now because bacteria are just evolving resistance so quickly. There's lots of reasons why they evolve resistance, right? So one thing, we overprescribe antibiotics, and so bacteria have more shots at developing resistance, right? Patients not finishing their treatment leave enough bacteria around to be able to multiply and trade genetic information. So if they happen to be resistant, they can spread it farther because they've survived the patient that was taking these pills. More than half of our antibiotics are used on livestock that in order to keep them alive long enough for us to consume them. So the vast majority of antibiotic resistance is either happening in hospitals or in factory farms with different creatures that are being loaded with antibiotics. And the bacteria have a chance to mutate within them, or in these settings of hospitals, right? Hospitals are very dangerous because we combine all of the most dangerous diseases together, and they might share genetic information with each other through a process known as lateral gene transfer. And there's not any new antibiotics that were being discovered, so there's nothing new to come to save us, which is a little troubling. Okay. I think I can discuss the 1918 influenza, which, as it may be obvious, happened in 1918. The very first few cases were in Kansas, but because the United States was in World War I at this point, we weren't actively reporting these deaths. In fact, the only nation that reported deaths was, or reported them accurately, was Spain, which is why it's called the Spanish flu. And in fact, the Spanish government complained loudly about this, and they suffered quite a bit of backlash in the public because of this. One of the really bad consequences of the 1918 epidemic was that it targeted working age people, 1840. And some cities, so here I guess light beige coloring is when there were social distancing measures enacted in that particular city. So we had able-bodied people that were dying at a greater rate. And some cities took it more seriously than others. So these are the people that were going out and infecting other people. Philadelphia had a parade, despite the best warnings of public health experts. They had a parade, and shortly thereafter, they peaked in number of deaths. They began enacting social distancing measures, but it was very, very late, and they were one of the hardest hit cities in the country because of this. They had an average of about 748 deaths per 100,000 people during the pandemic. San Francisco relaxed its social distancing measures a bit too early, and so they faced a long second wave that increased their death totals. New York and St. Louis had strong social distancing measures, and they averaged much lower mortality rates. St. Louis attempted to relax their restrictions, and then they suffered because of it. You relax them too early. New York, contrary to what's happening now with coronavirus, had actually the lowest death rate on the eastern seaboard. And in fact, when you look at the cities that didn't take this as seriously as other cities, they averaged many, many more deaths. Pittsburgh taking the highest death rate at about 807 per 100,000 inhabitants. There's a lot of other cities that had different results. And then the cities that took it the most seriously had much, much, much lower death rates, right? So the social distancing measures worked in these cities. Columbus, Ohio had a weird double peak, even though they had social distancing measures. And it'd be interesting to dig into the data to see why. So that's the 1918 pandemic. And you know what? Let me just finish this entire lecture. Let's just wrap this all up. Let's talk about HIV. Most people progress through several stages fairly typically, where they have several months of asymptomatic spread. They don't realize that they have it, and they can still spread it to other people. And then they develop fever, diarrhea, cough, weight loss, lymph nodes, eventually upper respiratory tract infections. They're in bed about half the time. And then really what happens for a lot of people is opportunistic infections kill them rather than HIV itself withering them away. There's a lot of images that I purposefully am not showing you because it is a horrific set of consequences. Some people go through it very quickly. Other people can have HIV in their body for more than a decade, even without treatment. In the 1980s, the gay community was particularly frustrated. It was called GRIDS at the time, gay-related immunodeficiency syndrome. They were particularly frustrated that the Reagan administration was purposefully being silent. The community blamed them for the 90,000 deaths during that period. And you see these jokes, right? Like, this is a press room briefing, and the Reagan's speech, not speechwriter, his what do we call? We haven't had one of these in a while. Um, the people that give press briefings, Larry Speaks, was particularly making fun of it and accusing the reporter of being gay as if it was a joke. And this went on even when people were thinking that maybe saliva could spread this, which wasn't limited to gay individuals. But because the Reagan administration and other people thought that it was targeted in the gay community, and they didn't think of the gay community as their constituents, they didn't take it seriously. It wasn't until a young child named Ryan White who contracted AIDS in 1984. That is a typo. 1984. Who was then eventually expelled because of the disease and died in 1990. The gay community used, well, with his permission, with his family's permission, used him as the poster child to show that it wasn't just targeting the vulnerable gay population. It was also targeting people that were just poor, or had bad luck to receive tainted blood transfusion. And so the Ryan White Care Act has provided HIV and AIDS treatment to low-income people living with HIV ever since, and it's been reauthorized several times. There's something about having the right poster child which turns the public imagination, because it's a story that it is a person that people can see themselves in. They don't see him as the other. And as a result, the HIV crisis in the United States, at least, has declined, although it has spread and has continued to devastate most of Africa, especially sub-Saharan Africa. HIV, most people don't know that they're infected. Most people get it through sexual transmission. And about a third live without symptoms, or 2/3 live without symptoms. We've developed these drugs that allow HIV to be suppressed in the body. 2 people have been cured from HIV, but those tend to be people that got bone marrow transplants. It's very specific cases. But by and large, the antiretrovirals, these have been able to treat people with HIV. So if you have HIV, it's no longer a death sentence, unless you're too poor to afford these, which is why it's had such a horrific effect on sub-Saharan Africa, and still is destroying that continent. And nobody is acting on this, even though we have the drugs to treat it. And I don't want to say nobody. I mean, there are non-governmental organizations that are treating this, but again, because we tend to look, the people with political power tend to use that political power to help the people like themselves. Most of Africa does not have pull in the world, and so it cannot get the treatment that it needs. It doesn't have the economic or political might to do that. So maybe the 1918 pandemic or the HIV crisis can help us understand what's going on now. And that'll be what we turn to in our next lecture.